We did this work with the kids, young kids in the schools, and it was amazing to explain what means to live with like a different, no, and someone that are different from one others. You have to answer. Okay. And so this is the first that we already done, that we just finished 1 month ago. After we have a psychological support desk for passion. This is our second year that we did this project, and the first year we obtained an amazing engagement from our community, so we decided to do this again. And the third is to organize the annual passion event 2024. Last year we organized it after the global consensus paper, if you remember. Enrica was so stressed, and but we have a lot of participants. We receive in Milan 130 passions from all around Italy, so we want to do the same this year. And the last one is in a startup phase. We would like to, it's a big project to organize, but we would like to organize a road show among Italy hospitals to understand what we have and what we are now in Italy, to understand what we can do in the future. So we have to understand our situation in all Italy, not only in the reference center, where we have more linked, more contact, but we have to understand the situation also in other hospitals that maybe we have never been. So yeah, this is, I would like to give you, maybe you can pass, you can see, this is this book that kids have written with this professor that has got a desmoid tumor, an intraabdominal desmoid tumor. And it's the story of a young kid with a desmoid tumor in his left arm, like me, and with red hair like Enrica. And they made pictures, they have written songs about it, and we went to the schools, and we read this book together, the kids, and we dance and sing. It was an amazing experience, and we try to teach them that, yeah, the different, maybe, yeah, is not perfect. The ray is not perfect, but for us, it's very important to have inclusion of all the kids that don't feel different from the others. So I share them my tumor and say that, yeah, I know that I'm different. It's an aesthetical problem, maybe for me, not only functional, but yeah, you can call me Wonder Woman if you want to see in with other eyes, and receive a lot of smile and laughs. It was an amazing experience for us. So we are very proud to share with you. And we have sold these books, and with the money that we receive from this sale, we give support to the Turin Hospital. There is a laboratory that are studying some what do you call, they are trying to grow some tumor tissue from the cell from biopsy, to understand how it works some drugs before to try to the patients. So it's a project that called Leopard. And so we give all the money to this project to try to help the research with the help of the kids. So it's nice and simple for us. The other one, as you see, is the psychological support. This is free for all our desmoid patients, not have to be member of our organization. They had loved this project last year. We have two psychologists, and they are do their support by Zoom. There are 2 days every week. A day is not one-to-one, but is a focus group. And it was very nice because passion, get to know each other, share experience, have to peer-to-peer support. And it helps you a lot also to do more network, because our passion are engaged in our organization, and then they come to our event easily. So the other project is our event of this year. We are in progress with that. We are trying to organize in Rome this time, not in Milan. We would like to do 2 days because our passion asked us to do not only a scientific approach, not only to say with clinician, but to try to learn something, but that have another day to say all together. They want to have a human psychological support. They want to stay together. They want to network. So we have to do 2 days and organize some activities also together. And we would like to maybe this year to treat more the local therapist topics during this year. That last year we didn't do so much about that. And the last one is all in the startup phase. Yeah, as I told you, we want to try to understand the current state of our territory in order to understand what we can improve. So we want to do some roadshows, some meetings in Italy, not in our reference center, but in some hospital that we don't know so well. So it's important to find new patients, to understand how much passion we have there, so to understand the situation, and to have more network with the new doctors to understand what, if they know, if they are awareness about global consensus paper and new therapies, local therapies, and with them to improve our networks also where we didn't arrive until now. So it was a big project, but we hope to do soon, to organize it soon. And stop.
So thank you so much. Any questions from the others?
Any questions?
Yeah, I really like the project with the psychological support. Maybe you told me already, but who is paying a psychologist actually?
Who?
Like, who is paying psychologists?
Who's paying?
Because
It's paid
Yeah.
for him. Okay, we do that because we notice that we normally pay for two psychologists that has got 2 focus group, 2 days during the week for 3-4 months. It's open to all Desmoids patients. I know this is a commitment. I know this is expensive, but we notice that then the patients are more engaged. And when we ask to do maybe some help or maybe to come to the events, we obtain a lot of engagements. So it works.
Yeah.
It works so much. So I suggest you to do the same because really Desmoids patient needs a lot of psychological support. And if they don't have psychologists, they call me and Rika. So maybe psychology.
Okay.
How did you select the hospitals for the roadshow?
Different.
I mean, these are obviously not the big
Yeah.
centers, so
Yeah.
are these smaller hospitals or just by chance?
No, they are maybe some hospitals that are already in our networks that we know that there are clinicians that treats our tumor, but we don't have so many networks. Maybe we don't know them, or we don't know, we never been there. tumor, because normally we have a lot of contacts with Milan, Rome, but during other meetings with network, we discovered Naples, Bologna, and we talking with a lot of clinicians that told us that they treat desmoid tumor, but we don't know that. So maybe they told, please give us some information. We made awareness about your organization. You can do the same. We can, but I have to be sure as an organization that they, yes, follow the guidelines. There is that all patients with desmoid tumor in Italy have the same opportunity and the same quality of life to be cured, be treated near their home. So we want to improve our network, and there are some clinicians that we meet during the meeting, so we know that they know about desmoid tumor. This is not so new. So it's not reference center, but it's the spoke.
Thank you. Okay,
Thank you.
so the next speaker is Russia from India. Need to change from here. Yeah, you can sit down and then you can from here forward. This is the forward. Yeah.
Hello everyone, so I'm Rashi Kapoor from Sachin Sarcoma Society, India. Sachin Sarcoma Society is. Nothing has changed. Yeah,
Yeah.
right.
Yeah, but this,
It's not changing.
yeah.
Maybe it's not connected. Yes.
No.
No, nothing.
If I can figure it out. Oh.
Maybe you can close the other.
Yeah, stop screen share and start again.
No, I think we should close the other ones.
And maybe that'll do it.
No, this one.
Can you, oh, now we're back to this. Hold on.
No, the screen, this is gone.
Yeah, Catherine was trying to show me how, yeah, don't touch that right now. Sorry, y'all. We're recording these sessions for Zoom, which is the reason for the camera being on. But I don't know what this means. Sorry, I'm sorry, everyone. Just give us a moment. Sorry, everyone. Because it's all in another language. I don't know. Yeah. But it's, yeah. Maybe that's it.
That's,
Okay, that's,
I know.
now let's try it. Okay, now
it works.
Thank you. What did you? The presentation.
I
You were trying
think
to
we
change
have
the presentation.
yeah,
Yeah, let's change.
I hope.
It's hard because the program's in the.
How do I change to this? I need to
This
change
is to move forward.
to move forward.
Okay.
Sorry. Thank you so much. Thank you. So I'm Rashi Kapoor from New Delhi, India. I myself am a synovial sarcoma survivor, and I completed my treatment in 2016. And after completing my treatment, we decided to form this patient support group, Sachin Sarcoma Society, which is in New Delhi, India. So Sachin Sarcoma Society is a patient support group formed in 2018, and it is a group of all sarcoma survivors. And we all took treatment from one of the big hospitals in India called as All India Institute of Medical Science. This is a hospital in New Delhi where patients come from all parts of India. This support group is registered in 2018, and from last 6 years, we have been able to make an impact on 7,000 patients, out of which there are 300 desmoid tumor patients and 200 GIST patients. Our support group basically works for India and with one hospital, All India Institute of Medical Science. Now, you all must be knowing that India is a vast country and there are many states. So there are almost 30 states. So we have patients from all parts of India, and also there are international patients from there are international patients from Mauritius, Nepal, Bangladesh, and many other countries.
For her business. Now we have.
So it's not.
What did you click on that made it change?
Yeah. She has to disconnect to Zoom because otherwise it doesn't work. Yeah, because it's. You can't do anything, so.
It's back. Okay, it's working now.
Yeah, but.
Basically, our journey began in 2018 when we decided to do ground level operations, and we started going to the hospital, meeting patients, interacting with them, knowing their concerns. Initially, we were meeting sarcoma patients, but like we were sarcoma patients, we were able to meet many other patients, and we started meeting desmoid tumor patients. So we felt that just like we faced many challenges during our time, desmoid patients also, they faced many challenges, like they were also misdiagnosed. They took wrong treatment from other hospitals. And the thing in our country is that there are less number of doctors who see sarcoma. So sarcoma specialists, number of doctors are very less who see sarcoma, desmoid, and GIST. And the treatment, like in our country, there are patients who are not able to afford scans or medicines like sorafenib. So the treatment is quite expensive for that reason. Now, even when the patient is on treatment, suppose desmoid patient is told to start with sorafenib, then they also face similar challenges. Like they have a lot of stress and anxiety. They have lack of awareness about the disease. They get hand-foot syndrome and high BP, menstrual disturbance in females, and hair fall and pain. So when we started meeting patients, we started looking at their challenges, and then we felt that considering their challenge, we can try to support them in the best possible way. So when we saw that there was a lot of stress and anxiety in the patients, we provided them emotional counseling. This we have been doing from last 2018. So today we are going to talk about few projects that we have done, and now what projects we are going to do. Many patients who came to the hospital were unable to afford the cost of the medicine or the scans. And in that case, we were providing financial support to these patients. Not only that, patients had no idea where to go because AIIMS is a very big hospital in India. So we provide them administrative support by connecting them with the doctor. Now, one patient, when comes to the hospital, he's already anxious. He has no knowledge, no awareness about the disease. So basically, we connect them with the other patient by adding them into our WhatsApp group. Our WhatsApp group, as we mentioned, has around 300 patients. So all the patients who come in the OPD of the hospital, they are received by us, and we add them in our group. Now, in order to educate patients, this is one initiative that we have been running from 2020 when the pandemic started. So we have been continuously doing weekly support group meetings on every Sunday at 4 p.m. And so far we have organized 206 support group meetings. So we do sarcoma education programs, desmoid education programs, and GIST education programs. In this initiative, we invite the doctors, they give educational session, and they address the concerns of the patients. This is a weekly initiative that we have been doing right from the pandemic has started. Even though pandemic has now settled, but since it is more convenient for patients to join from all parts of India and abroad, so we have been continuing with this initiative. Second is, this is a very recently started initiative, Project Rozgar. So what we have realized that in desmoid patients who are taking treatment, they have a lot of stress and anxiety. And also they feel that they are quite unworthy. They are dependent on their caregivers for the treatment. So they wanted to be financially independent. So like when we met one patient in the OPD, the patient was crying. Why? That she was not having job. So that is how this project started. Project Rozgar, it's a project of providing employment to the patients on treatment. This is a recently started initiative. It's very innovative. We have collaborated with one MNC multinational company where jobs are provided to 13 patients on treatment. Out of that, 2 patients are desmoid tumor patients. We have been doing social events, conducting social events, and when we meet patients, so basically when we meet them, we talk to them, we interact with them, and we distribute information sheets. We guide them, educate them about what is desmoid tumor, what is beta-catenin mutation testing, what is PAP testing. So all these information are provided in our hospital visits. And not only this, we also support doctors by collaborating with them and helping them to conduct research. Along with that, there is one initiative called as Project Efficiency. So many times it has happened in the past that sometimes patients were told to take medicine like sorafenib, and doctors are told to stop the medicine because they were having too much of toxicity. So those medicines were donated to the needy patients. It gives us immense happiness to share that we have so far been able to make an impact on 300 patients, and we have provided financial help worth rupees 30 lakhs rupees, which is around 30 millions. So this helps patients financially. Now, this is a picture of a patient which we have taken the consent. So this is a patient from a small town, and he had abdominal desmoid. Now, when he went to his local place, he went to the doctor. The doctor had no knowledge. He was not a sarcoma specialist. He had no idea about the desmoid tumor. He was operated 11 number of times. When he came to All India Institute of Medical Science, which is a renowned hospital, and we met him, he was in emotional trauma. So we heard his concerns, we supported him, and we helped him financially by getting his scans done and providing him medicine free of cost. Also, he was told, helped logistically by connecting him and telling him which places are there near hospital where he can stay. So this way, this is just an example to show that how the support group helps these patients emotionally, financially, administratively, and logistically. Now coming to the research. So AIMS has been doing a lot of research. Doctors, they do keep doing research, and we as a support group help and support these research. This is a research which was published in ASCO this year, health-related quality of life, anxiety and depression in patients with desmoid type fibromatosis. So in this research, it was seen that in India, desmoid patients have a lot of stress and anxiety while they are on treatment. Now, how did we support in this study? We started counseling patients, and we started providing administrative support to the medical health professionals. So this is how this research was conducted. Second is this another study, efficacy and toxicity of sorafenib in desmoid type fibromatosis, a real world experience. In this study also, we provided financial support by getting MRI done of the patients and provided administrative support to the medical health professionals. This is the third study. This is a SORA stop study. In this study, patients who were taking sorafenib for 1 year, they were told to stop medicine and their effect was seen. So the results were amazing, and we as a support group has helped. This study was recently presented by Dr. Sameer Rastogi from India in ESMO Congress, and SSS has helped financially for MRI study for these patients, and our work was acknowledged in these research papers. Now, as I was mentioning about the weekly support group meetings, these are the desmoid education programs which we have been doing on Zoom. These are all the educational sessions where we invite the doctors. They are told to give educational sessions and their concerns are addressed. These are the weekly in-person meetings that we have been doing. This was the 100th meeting where we decided to do this in person. And these are some of the events and the Zoom meeting pictures that we have sent. The permission of these patients are taken so that we have taken the picture for you to show. So these are some of the patients who are helped financially by providing medicines to them and by providing counseling, by doing desmoid education programs. These are some of the pictures. So our vision for future is that we need to work a lot. We have to expand our outreach. We have to help more and more desmoid patients. We have to work on creating more awareness. We need to collaborate with the government to work on the patient advocacy. And we also need to collaborate with more doctors in terms of doing research. That's all for the day. Thank you so much.
Thank you. Any question?
Thanks. So last slide I missed. So I'm
Okay.
grateful to the doctor with whom we work, Dr. Samir Rastogi, my team members, and all the patients and caregivers and the volunteers. And thank you so much for giving us this opportunity to hear patiently. If there are any questions, I would be happy to answer.
Yes. Because you told us that you have a WhatsApp group, it's mostly 300 passion with Sarcoma, right?
Yeah.
It's on here.
But
Yes.
do you have all information about the work? Because we have a social network with Facebook, we have a group with 600, is much more passion. 700, and we are trying to collect their data.
There is
Because we
no.
want to create a register to let them know about new clinical trial, new therapies. So we are trying to do this. It's a huge work, but I think it's very users. And I want to know, you have only the WhatsApp contact, or you have a register of these 300 patients?
We have
Name, surname, what is the localization,
Yes, so we are working on making the database. We have record of all those 300 patients, their demography, their age, their location, in which part of India or abroad they are staying, so that we also have their WhatsApp group where patient, once they come to the hospital, they are received by us. We take their WhatsApp number, add them into the group, and the group is very heterogeneous. So one patient, if it posts a query, like if anyone says, I'm on sorafenib, I'm having hand-foot syndrome, the patient does not have to wait for the doctor to answer. The other patient who is doing well will say, okay, no problem, you apply some HAFU cream and you will be all right. So a lot of stress and anxiety, it gets relieved because the WhatsApp group is very, very heterogeneous. So this is how it works actually. And we have been maintaining the database for sarcoma patients, Desmoids patients, and just patients. And that's how it is.
Yeah.
We do have a Facebook page, but I believe that we have a lot of work to do, and we are working on, creating more. This year, we are also organizing one annual conference for Desmoid in AIMS Sondi, and it would be on 14th of July in the Sarcoma Awareness Month. So,
Okay.
any other questions?
Congratulations, because I think in India, I love India, I did this space just for 2 months. But
This is that's why.
It's your donation, right? The big difficult change in front of us, that we more organized for a hospital center or connected people. So your work is wonderful.
So actually, our resources are very limited, and we are trying to make an optimum benefit to the patients and trying to make the journey easy between and coordinate between the doctor and the patient, so that explaining the doctor's perspective to the patient and the patient's perspective. We work with Dr. Samir Rastogi, who is a additional professor in All India Institute of Medical Science. So this support group is started with his support, and like all the scientific content input is being given by him, and that's how we.
How many doctors are in your network?
So yeah, we work with one center. As of now, it's a big hospital where there are in one OPD, one outpatient department OPD, there are 100 patients who come in one day.
They have to come to this hospital, or the patient can be treated?
The patient, that we do have website, so patient can contact us on website. We do have social media handles, they do contact us. When anyone contacts us, our work is to connect with the doctor. So this, if he connects at the right time, this helps his prognosis, and because he's connected at the right time. Like in that case study, that patient was operated 11 times. He's not aware where to go. So our work is to educate the patient and tell him to reach the right doctor at the right time.
Yep. Quite well.
Thank you. Thank you so much.
Thank you. So our next presentation is from Desmoids Brazil.
Yes. I know, but I need to move this to the
Okay.
desktop. They,
Now on the stick.
I know, we got it now. Yeah, we're going with this. I think I got it. The menu for the drive.
Yes. You always have to go in the left corner and then the window for the folder pops up and then you can open the next one and put the presentation here. Yep, can start. So try.
No, it's. Michi?
Ja.
Weil es wieder nicht weitergeht.
Eigentlich sollte es gehen. It goes like this, okay. Comments to work.
Thank you.
Hello, everyone. Good afternoon. Initially, I would like to thank SPAGN and to the invitation to be in this very important event. My name is Georgia Garofalo. I am a co-founder of Desmoids Brazil and Patients too. I'm not fluent in English, but I prepared this presentation and would you like it? I'm very happy. I'm going to make a brief presentation of our association and bring some of research present in ESMO last month. The Brazilian desmoid tumor began its activities in 2021, but we have a lot of story before that. After receiving a diagnosis of rare disease, the patients often feel along their journey. And these are some objectives: to inform, support, and empower our patients. It's so important now. And as soon as the patients receive a diagnosis, they research us through social media and hashtags. We begin a welcome process, and they receive a questionnaire and Google Forms. And after returning this questionnaire, they receive the welcome booklet. I have this booklet and join our WhatsApp group with around 300 patients. When I received my diagnosis in 2018, I looked for a group on Facebook with Carolina, and she told me that her dream was to create an association. And I said, why not? I'm crazy. We got together and with a lot of strength, faith, and courage. And we began our journey. We've been working together since then. Here's a little introduction about us. And now our talk and some images better illustrate our journey. I illustrate some events and important moments. In 2020, we started our national symposium. Some knows about our Dr. Celso Melo and Carolina. We started an entire month of lives with healthcare professionals and psychologists, and important exchange among patients. In 2021, we founded our association, and in September of the same year, we held our first international conference. In August 2022, we participated in an exhibition and this National Congress in Brasilia, together with the Rare Lives Association, in the big association in Brazil. Here we can see a booklet. We made this material in 2022 with Dr. Filipos Costa. In the same year, we got support for National Desmoid Tumor Day in September 15, and we received an award for rare women who makes a difference and rare disease. And we joined Henrique and Julia. We joined research and pregnancy and Desmoid with Desmoid Foundation, and Henrique and Julia was also our conference too. And in the last year, we participated in the Global Consensus Milan, CITOS Dublin, ESMO Lugano, and now in Roma with SPAGN.
And Pasha advocate the events.
Yeah. Yeah, consensus. ESMO Lugano. And here are some graphics, but it's so extensive. Carolina present in last month in Lugano about our numbers, our study, and this publication with Dr. Celso Melo too. And the last month, we decided invited some patients to help us because it's too many work about this. Here's some patients and the Desmoid family. We are volunteers, and now the most difficult for us is to help our financial support to our conference and some important events. And here are some doctors, our medical board, and they encourage us every day. And we call them godparents, Dr. Celso Melo, Dr. Filipos Costa, Dr. Bruna David, and Dr. Fernando Campos. Sadly, we recently lost Dr. Celso, an important professional, research, and human being. Here's our tribute to him. And today we are with SPAGN, happy to be part of the blog, the Latin America webinar, and this important conference. Thank you to everyone to support, engage, and our association, and to SPAGN, to entire team, to invitation and support. We have a slogan, we are rare, but together we are stronger.
Sure.
Thank you.
Great.
Question. Okay, thank
To
you.
make the patient group, where did the money come from? Yeah.
We send by email after Google Forms.
Yeah.
We make a number and it's okay. This is a patient, real patient, and because this Google make a support for the publication and the real numbers, and after the patients receive this is a start about I send for
All the information.
what's a tumor desmoid? How can I feel about psychology? What happened now? The best actuality treatments and no serious.
Pay for it?
No. It's nothing. Nothing pay nothing. Nothing pay nothing. Today it's totally free. We have site with Advocacy. I don't know the name in Brazil in other words, but Advocacy. We can change some $1, no, some but donations, yeah.
Okay.
Yes.
Any more questions? So thanks a lot.
Thank you.
I think you have
Yes,
really
yes,
achieved a lot
yes.
during the last years. So our next speaker is Audrey from France.
For a very short presentation compared to the previous ones. Sorry. So I'm Audrey from SOS Desmoids, which is the French patient group for desmoid tumors. It's a very old group created 25 years ago. So maybe I should have done a wrap up of many more projects, but I thought it was just about the latest news. So I'm just sharing with you the major yeah. In one slide, just the major topics that we are trying to address this year. I can't have the cheat sheet anymore. Yes, because last year when we met in Milan, for those who were there, I talked to you about the fact that we were building the patient stream for to defend the reimbursement of cryotherapy needles by the Social Security. So we asked for patients' feedback to be able to show what difference cryotherapy was making for them, what was good, but also what was bad, because we needed to show that we had an objective view of patients in this file. To be honest, in the patient group, we have very good feedbacks from cryotherapy, but we also know that not everybody provides feedback. So we were also interested in the results. So we had to analyze that. We were helped by professionals also to do that, benevolent, but we built this part, and I just had the decision yesterday, and it was approved. So we are very, very happy because it will help, I think, many patients in France. So that's the big news of this year for us. A new topic for us, but some of you, I think, have already heard of it in CITOS, maybe because Sarah Watson did a poster. We had a call with her recently about the link between iron, the level of iron in the cells, and the aggressivity of the desmoid tumors. So the assumption, the underlying assumptions of what they are studying is the fact that when you have a high level of iron markers, I'm not sure I'm using the right words. I'm not a doctor, so but that's the CD44, and there's another one. When it's high in the cells, it boosts the proliferation. So whereas when you have chelators of iron, then the lifespan of cells decreases, so they die faster. So they want to go forward with this assumption to study it further, and we introduced them to Chris Vlemans, who is doing research with the Xenopus model, because they would like to have an animal model to be able to test. And we think we'll see, but we hope that it is very promising, because you can see the level of iron in cells through MRIs with radiomics. So it could be a great way to predict the sensitivity of desmoid tumors to the treatments. Plus, if it's an interesting target for treatments, there is already existing medication for other indications. So maybe it would be faster to get treatments through this. That is a lot of maybes, and I was allowed to just say that there is this topic, but I think maybe it could be interesting to have contact with them for them to explain themselves what they are doing. So
that's something interesting for the I mean, but maybe you already did that for the DTRF research workshop this year, because Chris is already involved there, because I think his project was already funded by a grant from the DTRF. But so you can just send in an abstract and can present it at the research workshop there.
Okay, well,
so you can ask Sarah to do that, and
And then, well, last year I had talked to you about also a radiomics project and another one about the analysis of epigenetic alterations of desmoid tumors that was linked to the cryodesmo project, the cryoablation project of Professor Kurtz. But both are still ongoing, so I can't communicate on any results yet.
In which hospital is the epigenetic study?
It's in Strasbourg, because in fact
It's also the cryo.
yes, because they used the when they did the project on cryoablation, they kept some tissue in the same time because anyway they were freezing it, so they kept some tissue and use it to study the epigenetics. So indeed, it's in the same place. And I kept the line also for altitude. I don't know if you have heard of this, but it's a prospective database, a prospective cohorts of desmoid tumors that was created by, initiated by Nicolas Penel, who was our former secretary of the patient group, because our patient group's secretary is always a doctor. So, and we provided a grant for altitude because otherwise there was no funding to have it go on. And as we know that desmoid tumors are long-term diseases, if I may say, and that things can change with time, we think it's very important to try to go on and keep this cohort alive, to continue follow-up, because we can then address questions to Nicolas Penel to study, because they collect a lot of data. So for instance, I think it has been said already in a SPAGN conference that they have confirmed, for example, the fact that there is no contradiction, that is not a counter-indication, I don't know the right words, pregnancy when you have a desmoid tumor. The same thing for contraception. They started by this field, but they can study, address more and more patient questions. So we think it's a very precious database, as we have very few data.
No,
And that's it for me.
no, really impressive what you did. So. Questions? Okay. Netherlands. So then we go to the presentation mode. Yeah. Okay. Yeah. Okay. We do the thing. But it's only one. I think it's not a problem. Okay. So thank you. So the next group is from the Netherlands. It's contact group Desmoid.
Yes. I think most people know me, but I am Kim. I am one of the founders of the Contact Group Desmoids, which is the Dutch group. I'm here with Evelien, who is from Belgium. And of course, Netherlands and Belgium, they are pretty similar, so we work together a lot. And she now lives in Amsterdam, close to me, so that makes working together even easier. A quick introduction to our group is that we are the Contact Group Desmoids, but we are part of a bigger organization called Patiëntenplatform Sarcoma, so Patient Platform Sarcoma in the Netherlands. This is an organization for all patients with sarcoma soft tissue tumors. And we have 5 separate groups, of which the Desmoid group is one. But we also have an osteosarcoma group, a phyllodes tumor group, chordoma foundation group. So that's why we have similar logos. No. Yeah, no, it's not going there. Can also do it from my head, but
No, it's.
yeah, that's fine. So we were thinking about projects to present to you guys, and it's a little tricky because we don't do a lot of projects on our own. We do a lot of projects with the patient platform Sarcoma. As you all know, the Netherlands is very small. We don't have a lot of patients, but it also makes working together quite easy because the hospitals are all close together and they know each other. So this is an image of the Netherlands with the different dots being the university hospitals that we have. And in the Netherlands, university hospitals treat the very rare, very difficult cases, of which sarcoma is obviously one. The different colors of the dots, the light blue ones are bone tumors, the darker ones are GIST, and the green ones are soft tissue tumors. And what you can see is that not all of the university hospitals treat the same types of sarcomas. So we have very specialized centers for bone sarcomas, whereas for soft tissue, it's done everywhere. For the Desmoids group, we always try to understand which of those soft tissue hospitals are actually also Desmoid specialists. I think we all know that a sarcoma specialist is not always a Desmoid specialist or expert. So we know some of the hospitals that we are very close to as a Desmoid community, with doctors who work on the guidelines, that come to the Desmoid conferences and are very interested in Desmoid. And we have some hospitals that we rarely talk to. We know they follow guidelines, but we're not in so close contact. So that's how we try to kind of keep a grip on where the patients are as well. What we now have in the Netherlands is that we have a national system for all rare diseases, not just sarcoma, but all rare diseases, that the government wants to control where those rare diseases are treated to make sure that the expertise is really in certain places. We as a sarcoma community are one of the first to go through the process to actually mark hospitals and give them a certification of being the expert hospital. It's a very difficult process because it's a lot of bureaucracy and politics and money. And that's not something we as patients, of course, want to be involved in, but we have to. What is asked from us as a sarcoma organization is that the hospitals are allowed to fill out questionnaires, a lot of forms to say they want to be an expert hospital. And then we as patient advocates are asked if we agree. And we also have to fill out forms to say if we are in contact with the hospitals, if we're in contact with the doctors, what we think about their research projects. And eventually a decision is made by the government if a hospital is an expert hospital or not. We do this for all different tumor types of sarcoma, which is tricky too, because there's a lot of tumor types. So we now have certain hospitals who will have the certification of being an osteosarcoma expertise hospital, but not a Desmoid expertise hospital. And that's where we want to go to eventually have a clear image of where the Desmoid knowledge is and where to send patients to. It's a idealistic idea because I'm sure we'll never be able to send patients to certain hospitals. They'll always stick around different hospitals probably. But this is one of the ways where we really try to kind of guide where the care is going. But this is a national project that we do with the sarcoma team. Can I do it? Because something needs to pop up. Mm-hmm. Not again. Mm-hmm. I can also just keep talking. With all these different hospitals, it's quite limited. For the Desmoid hospitals, we are in very close contact with 4 hospitals, so 4 sarcoma teams. And the collaboration with the medical specialist goes both ways. So they work together with us. You can also just leave out, just talk.
Sorry.
That's all right. They also come to us with questions. So if they have a question about a certain patient, or a patient wants to move to a different country, where do I send this patient to? Which of the doctors do I send this patient to? So the communication with the medical specialist goes both ways, and that makes our work very special. Because we are also valued by the medical specialists. Other way around is that we are also asked to give our opinion on the grants that they go for or research projects that they go for. Me or Evelyn will be receiving an email from the doctor saying we want to do research on a desmoid with this and this topic. And we are asked to read with them and to help them get grants. But getting a grant is a difficult part that we'll be talking about later. Evelyn and I, we also work for the national guidelines on soft tissue tumor sarcoma treatments. So of course we have all these international guidelines, but eventually they have to be merged into national guidelines that the hospital eventually uses. And part of the guideline is that patient advocates also take part in the guideline writing process. And that's what we do for the whole patient platform sarcoma, not just desmoid, but all of the other sarcomas as well. And what we want to do in the future, because this is about future projects mostly, we have run into some issues with the National Cancer Registry in the Netherlands. We have a very big national registry for all cancer diagnosis. That keeps track on who gets a diagnosis, where are the patients, what specific types. But the problem with desmoid is that it's not a cancer. And therefore, it's not registered in the national registry. And the problem that we now run into is that if we want to get grants from big cancer foundations, they say no, because it's not registered in the national registry. And this is a whole ordeal that we're trying to find a way how to approach this, because we know we don't want it to be cancer. That's also not a positive thing for patients. If it would be registered as a cancer, but we need something else within this register. So that is one of our main projects right now that we are trying to push for. But we also do a lot of patient contact days throughout the country. We have a roadshow in the Netherlands where we visit all these hospitals already. And that's been very successful. So we will be continuing that. And we have a Facebook group, etc., etc. So of course we do a lot with patients too. But these are the big projects. That was it.
Okay, well, thank you so much. Just a question, the guideline you mentioned regarding soft tissues, are there desmoids in, or do you have some special? And for desmoid treatment, you have something or not?
I think actually for that, we're just following the
consensus
guidelines.
It's the,
okay.
yeah, that's already pretty straightforward.
Yeah.
Okay.
And the doctors, they are able to already follow that. So there's no need to make it Dutch. But for
Okay,
the
so-
other sarcomas, it's a bit more tricky, because you, of course, you have the ESMO guidelines,
Yeah,
etc.
it's
So you,
actually based on the ESMO guidelines, but then we, like, sometimes it depends also on availability of specific treatments, whether they're reimbursed or not. And there, like, you notice that there are slight differences in between hospitals and diagnosis or treatment schedules, and then we just try to put, one.
Okay, and you are allowed from the legal aspect to give some advice to go to this or that hospital, or just to say, okay, we know this doctor is experienced.
yeah. So that's the tricky part. We would love to be able to really say this hospital is not good or this hospital is good. We're not able to say that, of course, but if we would have the certification, then you would be able to say this hospital is certified, you have to go to this hospital. And that's why it's great that we're involved, because if we're not involved, then it could still happen that hospitals will be certified that we don't agree with. But that is a tricky process, because right now there's hospitals that don't get a certification, but they still treat patients. And right now there's a very tricky process ongoing, because that's politics.
Yeah.
And losing patients, they don't want to lose. So.
And that means money for the hospital. Money. So
yeah, of course, yeah.
Okay, so thank you.
No worries.
So my slide is the next.
Is this the next?
Mine.
Yeah. Question is, will it change life?
Yeah, but it's only the
Okay.
So I just want to introduce some projects we do in Germany. We are doing currently a project which is called BOSA Desmoid, and it's about the burden, the disease burden and the life situation of desmoid patients. And we do it together with the University Hospital in Mannheim and with the National Center for Tumor Diseases in Dresden. And we are focused on patients with a longer duration of the disease, of the life situation, and what are the impact of the planning of life and the familiar situation and the job perspective, and are they able to return to life? Because during the last years, I saw more and more that people from the desmoid community have social problems due to their disease. And yeah, I'm really excited what are the results of these projects are. We are founding this project, and yeah. So further, I'm doing on a international level together with Bernd some papers. One is about capturing patient voice to improve outcomes that matter to patients with desmoid tumors, which will be published in Cancer Management and Research. And another paper is a study to learn if nirogacestat works and is safe for adult participants with desmoid tumors. A plain language summary. I have to say this was really an interesting project, because you can see how you can easily make it understandable for patients, what are the benefits. So yeah, I hope that it will be published soon. And yeah,
that's actually a lay version of the New England Journal of Medicine publication from the DeFi trial, but in a very professional way, where there was an agency involved with nice figures, and this is very nice.
Yeah.
And it's done with so the journal is actually Future Oncology, and they started a kind of series on these lay versions, and so that's a very nice thing.
Yeah, but I think we have a company behind it who makes it easy to make it visible, because otherwise, yeah, it's not so easy to make it like this when you're not experienced in things like that. Yeah. Further, we did our patient days, and yeah, we will start a new website for the desmoid community in Germany, and yeah, that's it. So I think we can move forward to the discussion session about research grant. If you would like to give them.
The big question is very easy. How do we get money for desmoid research? I think this is something we all struggle with, and we have bumped into this issue multiple times. This idea eventually stemmed from a research group in the Netherlands Cancer Institute. They do a lot of quality of life research. They did the big Gravity trial in desmoid patients, where they looked for the best questionnaire, they looked for quality of life issues, and they want to continue their work. So they asked the big cancer research foundation that we have in the Netherlands, where a lot of money is put in for money. Can we do quality of life research on this patient group? And they kept getting no back as an answer. So eventually they went to ask them, why do we get a no? Why do we never get anything for this patient group? And their answer was very honest and very real. And it was that, well, it's not registered in the National Cancer Registry as a cancer. And we only give money for research on cancers that are part in this registry. So of course, we can all say, well, we should get money because it's, you know, it's an intermediate tumor, it's still a disease, it's very difficult. But their rules are very straightforward and we cannot argue with them as long as it's not in the registry. So now we've bumped into this very honest answer from them being, okay, so apparently we have to be registered different to get money. But now I'm wondering how everyone else gets money. What other ways do we have to get grants until we have this problem solved? Because this problem solving will take some time, but we still want to be able to apply for grants. We know the DTRF grant. Of course, that is, I think, the way, maybe the only way, I'm not sure, to get money, but I wanted to ask around how everyone else is involved in these issues. So give me an answer.
Sorry, the workshop you attended in Milano, May last year.
Yeah.
It was granted from the joint program on rare disease.
Yeah, from the EU. Yeah, and so you should apply there, you say?
Because, you know, it's, we apply like a rare tumor in a rare disease.
Yeah.
Because that's why it was, when we saw the application, we say, why not? It's a rare disease because familial polyposis is a rare disease. Desmoid tumor, it's a rare tumor. So it was, and it was a combination of few European reference network, Gentuis and Hera.
Yeah.
Okay.
So probably this could be an option.
Yeah.
But I always thought that the CRN network, they're more giving logistic support rather than actually financial support. I'm not sure, but thinking more like are supporting with arranging meetings with the logistics of it rather than that they have a lot of money and that they're actually giving grants.
Yeah, you say it's not so much a research.
Yeah.
Well, we have to ask them, I think, before we actually know.
Usually we have people that work to find for different association or industry that have the competencies to find money on location for grants that arise by bank, because in Italy, for example, so many banks do money for, you have to do a project, bilanci, or you say balance, you have to do, you have an association well organized, so seriously, and you have to do credential. But for example, even your central bank, because all central bank have a lot of money to give to all the foundation all over the world. All the to foundation, to non-profit organization. Okay.
Yes.
And you have to apply with a project that have so many limitations, restrictions, because you have to answer to so many points, but you can do it.
Okay.
I participate to write a project to finance this project throughout the erogazione to grants from Italian Central Bank, and we took 100 euro.
Yeah.
In Germany, we can go for the insurance.
100,000.
Yeah, that's what I got. Not 100.
100,000. 100 euro.
In Germany, you can go to the insurance companies, but the problem is they don't pay for research. They pay only, for example, my homepage will be paid by insurance companies. So this is an option.
Yeah.
But I'm thinking if we can do something together on an EU level for Desmoids, because I think we have all these problems more or less. And maybe we can have something like a basket where we put several projects in it from different countries. So this is something maybe.
On the culture, maybe also other banking, private banking. So not only the central bank, but private banking, a lot of the private company is money for non-profit. For example, also Philip Morris. Philip Morris, you can ask them because they give money for some project for non-profit. The difficulty is to find information. You have to find the right person to ask that speaks with non-profit, but they have a lot of budgets to do that. And not only I talk about we discovered this thing for all private companies. For example, in Italy, Desmoids and other companies, Barilla. You can ask. I know there may be. No, we think, but they are not medical affairs, they don't treat.
But you guys are a foundation, right?
There is not advertising of that, so.
No, you have to go, but where do you store the money? Because you guys store the money in your organization, right? They give you the money.
Yeah, in the organization, and.
We wouldn't be able to get the money.
Sarcoma platform, no?
No, so the difficulty also is that we are not a foundation. We're an organization and we are subsidized partly by the government and partly by Cancer Foundation. And because we get money from them, we have to adhere to their rules. So we're not allowed to get a lot of money ourselves. Because then that money will leave.
We can do it, but you have to do the right accountability, but you prove that you use in that way, but we can do it. I think that you can, maybe, I don't know, but I told you what I. If I your situation. I studied a lot my the detail of my mission about non-profit organization or society or Italy. We have so many different choice. Okay, so we chose for non-profit because it's most powerful for what we can do, and it's easy to gain money, to receive money from banking or public fund, okay, Italy or regional or from Rome, and from big society. So we have all documents well organized, the balance, okay. So we manage all these aspects in right way, but in this way we gain so many credentials. So
But so I don't understand. You can obtain money, but not only for Desmoids, but also for Sarcoma.
Yeah, but we cannot, we're not allowed to get the money. But we have to, I mean, the doctors, they'll come to us and ask us, are there ways to get grants anywhere? They ask us help for their grants, to guide them somewhere to apply. They don't ask us for money because we don't have money for them.
Okay.
So they only will ask
not only
us
for Desmoids, for
all the
platforms.
sarcomas, yeah.
So you can't have money for your passion service. You can't organize something for your passion because you can't have money, or you can.
No. So, okay, we our organization gets money from the government to do our patient work.
Okay.
So everything we do here, being here, doing the patient organization stuff, that is the money from the government. But the money from the government is not for
Not
research. And if we go ask banks for money for research, the government will say, you have money, you don't need us. Goodbye.
In which way they can control?
That's the rules of the subsidized money. If you get subsidized money, you have all these rules.
Designation,
yeah.
one for research, or one for passion. So, and maybe you can
Yeah.
manage different ways.
Yeah.
Maybe it's so useful
Or-
study.
Or is it a
The your local for research, say money for private company.
I know.
What for passion with the. But if you know the goals of your patient,
Two different.
you can choose the right organization.
Yeah, but for patients, the work that we do for patients, this is the right way to do it in our
Yeah.
country. This is the only way to do it, because with our organization, we're part of the National Cancer Network. So we're not able to become a foundation and step out of that. It would be something next to it, but it would only be for research grants. And I'm not sure if that's a possibility in our country's
You have
landscape.
to find something like the Society for Research, Desmoids research.
Yeah.
And only for research that has money to private company, to bank, to pharma, to, and only for research projects.
Then I still would need you guys' help, because we have
Sure.
40 patients a year. How are you gonna do research on 40 patients a year?
Yeah, but
We
this
can
So then
do
if patiently,
But we can do
we need other
together,
things.
this is informational research.
Yeah,
we do it
and-
together.
and I think maybe we can use SPAGN a little bit.
that would be great.
Yeah, but I'm not sure to store the money, to store the money and but then we have to go global, not or because. we
But then
can't
would it
do-
be Desmoid money or would it be
Yeah.
Sarcoma money?
No, no.
If we
I
do the
think-
work, we wanna have it.
Yeah,
Desmoid money.
sure,
Yeah, sure, together.
sure, but
You want to for the project that you're.
Exactly.
But I
Yeah,
think
that's another good.
if you don't find a way, you can't do
Yeah.
any research
No.
in the Netherlands,
For
okay?
the pregnancy study last year, without social Facebook and the collaboration of Brazil or other, we have more than 9,000. No, 900. 900.
And we reach, yeah, quite,
Quite-
so
quite-
1,000.
Yeah.
Patients all over the world.
Yeah.
Social network.
Quindi quite
Yeah.
1,000.
We do the work. We have to collect data one to one.
Mhm.
It was,
Goal of to write from collaboration and throughout the social media, Australian group, UK.
yeah, I know that it maybe is a national research, but the community that obtains the benefit from your research is not only your community.
No,
So we
exactly.
can
Yeah.
help you to do that.
Can we make our word, Desmoids word project? Tomorrow, maybe.
Yeah,
I don't have all the time.
Not the same from Brazil.
Yeah.
The Teleton.
Yeah, so, I mean, you would be able to do that, but still, you would have the storing of the money problem. We're not allowed to raise money.
Yes, but then the doctors that come to you can redirect them to one contact with the Teleton organization to get a part of the funds. that will be in the system.
Yeah, but well. Then you come back to the problem, it's not a cancer.
The Teleton is not found, at least in France,
Yeah.
it's not for cancer, and in fact, they collect so much money. I think it's an old story that we know it's that was everywhere, but I know that in France in the beginning, I think they were not expecting to collect so much money. But they collect so much, I mean, they kind of bad about it, but they share with many rare diseases beyond That's one, right? First one is the disease, but the major disease for which they were connecting to the immune. And sometimes it really helps. Like ours.
Yeah, I would have to check. I don't know if there's some things like that.
And
No, but just a question, but the problem that I can understand is that you have a problem
Mhm.
to organize research.
Mhm.
It means that because you could be involved also in an international project,
Mhm.
but you are not allowed to get money.
No, exactly.
yeah,
No. Yeah. I mean, our country, we join in a lot of collaborations. We have collaborated with Italy and with France and everyone. But once we want to do a research project and get a grant somewhere,
You can leave, right?
that's difficult. If it's not the DTRF, then we don't really have a way to get money.
Probably really advice from Julia and the guys to it's correct. You need to talk to someone in your country
Yeah.
that give you the advice how to split from research from a patients association to a research supporting association.
Because I think that you are not alone. This program is for all of the other disease and tumors in your country, no?
If it's not a cancer, no.
If you're not.
Because if it's a sarcoma, they can go to the National Cancer Foundation and they'll be, oh yeah, it's a rare cancer. We're so sorry, of course you get money. Because there's a big rare cancer project ongoing in the Netherlands where a big part of the money for cancer research needs to go to rare cancers. So rare cancers are being pushed and we are completely left out because we're not a cancer. And that's where it goes wrong, because these research groups that ask for desmoid research, they're the sarcoma groups. They know where to get money. They have so many research on sarcomas, but the desmoid is just left out the whole time.
But if you try to find another association or organization that on other pathologies that are not cancer, desmoid and not like this, but for example, another field that are not recognized as
Yeah, I mean, there's a few groups.
And understand which way they can.
and for example, do you know what the tenosynovial giant cell tumor?
Sorry?
The tenosynovial giant cell tumor, is there any group because they are intermediate as well?
Sarcoma platform.
Okay.
Everything is in our platform.
Okay, because
I feel it as well.
I think we can't store money from for research projects because we are not a non-profit organization then. And that's the problem as well, we can't store the money.
No, we have to fight to register.
No, definitely to have the actual consequences for us, so, yeah.
I'm not registered, because, yeah, they don't follow that there is a germinating tumors in the World Health Organization, the guidelines, because once I know it's
Intermediate,
yeah. But they need
That's why we don't register.
That's the problem. Only cancer is registered. Intermediate is not an entity.
You intended with a start with that. Correct? So because
I know, and we are fighting the system to get the intermediate also part of this registry, to have it registered. But that's gonna take a while too. So I'm trying to find other ways before this is
Basalioma. No, right? Do you know basalioma? The skin cancer.
basal cell.
Basal cell.
Yeah.
Not, it doesn't spread so much.
No, I mean, there's also in our sarcoma, in our patient platform sarcoma, there's other sarcomas or soft tissue tumors that are also intermediate. We have some groups as well with intermediate tumors. But they are very small with no research in our country yet. So they have not bumped into this problem yet. So it's now a desperate problem.
You can get money from private for
No.
for government
No. No.
from people?
No. If we do a fundraising, it wouldn't be able to be given to us. No. And if we give it to a hospital, then it goes in the hospital foundation. I know.
You're in a league, but you don't know.
I know.
You're not even who are you?
How many patients the Desmoids in Netherlands?
About like 50 a year.
15.
Yeah, 40, 50 a year.
50.
Yeah. And all very different, of course. So some a lot more aggressive than others. So they don't always reach us. But yeah. Okay. I will go and see what the private,
Yeah.
what the private community
But we are
can do.
thinking about to try to talk the politician.
Yeah.
So.
Yeah.
Because probably from you don't have chances to.
Yeah. No, right now we have,
Nice.
yeah, we are now in talks with the National Cancer Registry and with the integral community, more the research part of the National Cancer Registry, where they actually do research on the numbers. We now have some people that are also board members of our organization that worked there previously. So we're now hoping with their context to push this forward. But it takes time, and we have some research projects that we really want money for. So I'm just trying to find other ways now. And it's just difficult. Yeah.
Yeah. So thank you, and I think this was really a nice discussion, but